Hi, good morning. Uh, Please subscribe to the channel and give it to your friends and distribute knowledge because it is all about health. And thank you. Now, this is about the prostate in men, prostate hypertrophy. Hypertrophy hyper mean more, trophy mean the cells get more in number. So the prostate gland increased in size. Of course, the prostate gland, it is prostate in men, which collect the semen. And it is around the upper part of the urethra. So if it is enlarged, it will compress on the urethra, which is inside the penis, and this will cause difficulty in micturition. So the men, they will take a longer time to pass urine, and sometimes it comes as drops. So it is very uncomfortable. And when they go to the doctor, they do for them a blood test, which is called PSA, which is P from prostate, S specific, mean exactly, antigen, meaning the antibody which cause the hypertrophy. No, antigen, it means the protein, which cause the hypertrophy. It's not the antibody, it's the cause. Okay, antigen, which stimulate the prostate to get hyper. It is exactly like the breast in the women and how they develop cysts, masses, and then carcinoma of the breast. So now, the prostate. Why? With age, it become bigger, and then slowly and with time, it will have cancer cells. And the research shows that all men, they have microscopic cancer cells in their prostate, especially if they get older. If you become older, then almost 100% you have cancer cells in the prostate gland. And how do I know? Because I have read about it, and they do autopsy, meaning after death they take biopsy and they found that there are cancer cells. But not all men show cancer. Why? Because the immune system, which is the defense mechanism in the body, control the cancer cells. Now, so what are the practical points which we could do is the natural lifestyle. This man who asked me to do the video, he is more than 65 years old. He is diabetic for the last 32 years. And he has a tremor in his hand, which is indication of some neurodegeneration in the brain and hypertensive. But I advise him, and he follow the advice carefully, which is he start to eat only one meal a day. Number two, he do exercises. This is, of course, he do exercises before I advise him. He does a lot of exercises, in fact. And he take vinegar with water before meal, after meal. He try to sleep well. So he follow the healthy lifestyle. And what happened is that his blood pressure become normal, so he stopped the tablet, and his blood sugar start to be stabilized, and he reduced the dose to half. Okay, so he is in the path of healthy lifestyle. But sometimes we need tuning the detail. The devil is in the details. He did a blood test in India and showed that there is a rise in PSA. First of all, I would like to say that PSA, this blood test, is not specific. It's not very exact blood test. So what one should do really is to do MRI, which is 10-minute test to check the prostate if it has cancer cells or not. And this is allowed in UK because I heard it on BBC4. It is better than PSA because there are many men who develop metastatic prostatic cancer and nobody do for them MRI or even the blood test. And I know one of my relatives like this. So he did it. He did the PSA and it was too late. But He is treated with chemotherapy, radiotherapy, and now he is in remission following healthy lifestyle. So I have experience of advising many men with a prostatic problem, and the advice is as follows: is to expose themselves to sunlight in the morning, to respect the circadian rhythm day and night, so that the cells will function according to their program of timing. Our cell works according to a timetable. And how to prove that? Because Professor Jeffrey in London, he did the red light to the eye for 3 minutes, 670 nanometer for 3 minutes between 8 and 9 in the morning, and he noticed that there is improvement in the vision, especially the color contrast. But when he did this experiment, after a week, in the same patients, between 12 midday and 1 p.m., there is no improvement. Why? Because the mitochondria and the cell, it has time to respond to red light in the morning, but not in the middle of the day. There is a program. So exposure to sunlight in the morning and exposure to red light and near infrared light, and the blue light, which is in balance with all the wavelength of the light, it stimulates the body, the cells. When I say body, it is the cells, to do their work. And each time and each wavelength nanometer, it will affect the cell differently. This is the sunlight, which is now number 1 in health, to be honest. Number 2, exercises, which he is doing, because exercise prevent cancer. Why? Because the cells will produce myokine, which is like hormone, which affect all the cells, and cytokine, and the immune system will be stimulated to produce natural killer cells. Natural killer cells are the cells which kill the microscopic cancer cells, which happen in everybody of us. Every day, our body produce cancer cell. What is cancer cell? It means that the cells, it has changes in the DNA. And it is abnormal changes, but the immune system get rid of it on regular basis. So now I repeat is the sunlight, circadian rhythm, the exercises, the food, 1 meal a day, no sugar, and to check the sugar level in the blood, ketone level in the blood, and fasting insulin, because one should be in nutritional ketosis, meaning the ketone in the blood should be between 0.5 millimole per liter to 1 millimole per liter to 2 millimole per liter, and this is very healthy. Why? Because the ketone are anti-inflammatory, and they are very good source of energy to the cells, meaning that the cell, when it take the ketone to produce energy, especially in the nerves, in the nerve cells, in the heart, in the kidney, in the liver, it will be less oxidative free radicals, which is called ROS. ROS means reactive oxygen species, which produce damage to the cells. How? Because they are unstable. They have missed one electron. Electron is negative energy. It is negatively charged, and it is unstable, so it stick to protein, DNA, RNA, to any organ inside the cells and damage it. And sugar is very poisonous. The body consider it poison, although you like it, but the body cannot tolerate sugar, because the sugar, it causes glycation, meaning it will attach to the protein inside the cell, and the protein cannot function. So although your blood level is normal and your hemoglobin A1C is normal, but your insulin hormone, if you check it, is high, because it try hard to keep the blood sugar normal. The problem with blood sugar is not the level of the blood sugar. It is the insulin hormone, which is a growth hormone, and if it is high, and in this case he is diabetic, this is a growth hormone. It will make the cell grow. So it will also affect the cell of the prostate. So, and also the cell in the lining of the blood vessel, which is supplying the blood to every cell in the body. So blood sugar is very, very important. to keep it normal, but most important than the blood sugar is to keep the insulin hormone normal. They don't check it in the NHS, so please do it privately. And be careful with your blood sugar and try to reverse the diabetes. Sleep is very important because it is help the repair of the cell and help the brain to clear itself from toxins. And positive thinking, grateful, practice the philosophy of gratitude, and be happy with what you got. And also, this good man, he is very serious and he's stressed. So I would suggest to reduce his stress, because stress is not good, because it will raise cortisol hormone and adrenaline, and this will raise the blood sugar. And he is usually perfect, and especially when I come late to the class, he is very annoyed. He said, no, we should be on time. But now he changed his attitude and he is more relaxed, because we are human and we don't want to be stressed. And sometimes I have to do YouTube before I come to the gym. So I'm doing serving the others. But now he understands, he doesn't. So that is the line for the prostate. This is the first part. And also there are a lot of studies by Dr. Dean Ornish, D-E-A-N, Ornish, O-R-N-I-S-H, who did a study on prostate 0 and phase 1, and give them healthy lifestyle, and they did the genetic or the genome, and he found that about 40 genes, the good one, start to be activated against cancer of the prostate, and more than 400 bad genes, bad because they produce a protein to induce cancer, they are stopped. So this is Dean Ornish, D-E-A-N, Ornish, O-R-N-I-S-H, and you can Google it. Or in Pub Medicine, P-U-B Medicine article, you could see the abstract of these studies. Thank you. Good luck. Bye.